This video has been developed by the Rehabilitation Services Department with support from the Cardiac Sciences Program at St. Boniface Hospital. It was made to help with the transition from existing sternal precautions to a new way of allowing our patients to move after sternotomy during sternal healing. Currently, there is no universally accepted definition of sternal precautions. Our current precautions of no pushing, pulling, or lifting more than 10 pounds are not validated in the research. After evaluating the literature, movement based on kinesiological principles has been effective in improving functional outcomes and decreasing length of stay, with no negative impact on sternal dehiscence rates. By instructing patients how to move safely and within their pain tolerance, we expect to see faster return to functional activities and improved quality of life, therefore decreasing length of stay in hospital. Once the sternum has been cut, steel wires are used to hold the bone together to allow for bone healing. The pectoral muscle is the main muscle in the chest. It attaches to either side of the sternum, part of the clavicle, and inserts onto the upper portion of the humerus. When this muscle contracts, there are forces exerted across the sternum. Following principles of body mechanics, patients will be able to use their arms safely to assist with activity while the sternum heals. As patients heal, they will move through 3 zones for arm activity. Every day, with all activity, in any zone, patients should feel comfortable and have no increase in discomfort or pain at their sternum. Zone 1 is when the arm is closest to the body. This zone puts the least amount of stress on the sternum. Zone 2 is when the arm is starting to move farther away from the body. And finally, Zone 3 is when the arm is fully outstretched to reach far away from the body. This zone puts the most amount of stress on the sternum. Patients can move back and forth between the zones throughout the day. Heavier objects will be moved in Zone 1, while lighter objects can be moved in Zone 2 and 3. There is no set time limit or specific weight assigned to each zone. People will progress the weight they are able to support in each zone based on their individual healing. Activities can be modified to be performed in all zones depending on patient healing. It will be rare that an activity will have to be avoided or limited completely. If patients have questions about specific activities, please refer them to the physiotherapist or occupational therapist on the ward. The way that we teach patients to move in hospital is going to be slightly different than how we teach them now. The main change is to let people move however feels natural within their pain tolerance. There are no strict rules or do-nots. Instead of the current response of no, when patients push or pull with their hands, ask them how it felt. If they have no change in their discomfort, they can use their arms as they like. If they have an increase in discomfort or pain, coach them to bring their arms back to their body or not to put so much weight through their arms. Coughing and sneezing puts a substantial force on the sternum. Supported coughing still needs to be enforced. The heart pillows should only be used for support with these activities. They are not meant to be held to the chest for bed mobility, transfers, or ambulation. Everybody heals at their own pace. A movement that is painful for some may be fine for others. Some people may need more assistance, while others achieve independence sooner. The amount of weight people can support will also vary based on their healing. Starting at post-op day 1, it is important to give patients the same cues for safe movement to allow them to assist with active transfers. They will need more assistance on day 1 as the sternotomy is fresh, as well to manage all the multiple lines and tubes. In a fast-track patient, as they progress towards post-op day 3 and 4, they should be nearing independence with all transfers. Let's review a typical interaction with a ward patient in hospital.
Good morning.
Morning.
How are you today?
I'm okay.
That's good. Can you tell me your name?
My name's Dave.
Dave, perfect. You're just the guy I'm looking for. My name's Sonia. I'm from physiotherapy.
Hey, Sonia.
And I was hoping we could go for a little walk.
Sure, that's not a problem. Would I be able to use the washroom first?
Yeah, no problem. All right, let's get you going.
Okay.
Okay, so I'm just going to take this away here. we're just gonna take your blanket down, okay?
Okay.
All right. Down. Good stuff. You're gonna bend that leg. Yeah, good. You're gonna take your arm, you're gonna reach it across and push with that knee to roll onto your side. Good. And now bring your legs off the edge of the bed. Both of them, yeah. And now you're gonna push up with your bottom elbow and top hand to sit up. Very good. Good stuff. Okay. Good. So now you're just going to take your hands and put them on the bed. To get to the edge of the bed here, you're going to get your feet on the floor. So you're going to wiggle your hips from side to side. Perfect. Very nice. And then now to stand up, you can keep your hands here. And you're going to push with it from there. And you can just stand up.
Okay.
Very nice.
Okay.
How was that?
It was sore, but not any more sore than it was just lying in bed. So.
Okay. Next time, maybe try not to hold your breath
Okay.
and breathe as you're doing the motion.
Okay.
Okay. All right. Good. You just go right in. Good. Okay, just reach back. You just pull the bell when you're done.
Okay. Thank you.
Reaching to wipe after a bowel movement may create more pain initially. Allow the patient to first try and then provide assistance for thoroughness. If the patient repeatedly requires assistance, please consult occupational therapy to assist with problem-solving a solution for discharge. For women, putting on their bra and wearing a bra may be uncomfortable. Doing up a wireless bra in the front and wearing the chest band looser will be easier and may feel more comfortable.
You're all done?
I am.
All right, let's get going then.
Okay. Good.
Oh, that looks quite sore.
Yeah, that hurt.
Okay, so actually what you can do, your arms are quite wide on the bars there.
Okay.
So you're gonna put your hands closer. Yeah, exactly. And you put them on your lap.
Okay.
And then what you're gonna do, we're gonna rock. So we use some momentum to help you stand.
Okay.
All right, so you're gonna go on 3. Ready?
Okay, on 3?
On 3.
Okay.
1, 2, and 3. Beautiful.
Okay, good.
How did that feel?
Much better.
Okay.
Yeah. Okay, I'm just gonna wash my hands here.
Yeah. Let's just put your house coat on here, okay?
Yep.
Is that pretty tight? It's pretty
Yeah,
sore, eh?
that's
Okay.
tight.
Now what we can do is we can actually get you a bigger gown and it'll
Okay.
be looser and easier to put on.
Okay.
So there'll be more room, okay?
Sure.
I think this one's bigger.
Yeah, it's a bit better.
Oh, yeah. How's that?
Okay, good.
Good. All right, let's go.
Awesome.
Good, and we can go that way. So I'm going to get you to stand up nice and tall and keep your head up. There you go, and keep your eyes looking forward. Perfect, and relax your arms. Good.
Well, what'll happen is...
How are you feeling there?
I'm a little bit tired.
Yeah, I think it's time for a rest. Let's sit down in the chair here.
Okay.
Good, we'll just turn the walker. Good. The brakes on.
Okay.
Excellent, yeah, and you can sit. Very nice. Oh, it sounds like you have a cough coming on there.
Yeah.
Why don't we do some big, deep breathing and coughing then?
Okay.
Okay, so what I want you to do is you're gonna breathe in through your nose and then out through your mouth. Good. You're gonna breathe in through your nose. Yep, hang on to that. And out through your mouth. Good. And now on this third one, you're going to breathe in through your nose. You're going to hug and squeeze and cough. Very nice.
Coughing and sneezing increase the thoracic pressure in the chest and can put up to 60 to 90 pounds of force across the sternum respectively. It is important to continue to coach patients to support their sternum with their hands directly on their chest or using a pillow.
You ready to start walking again?
Yeah.
Perfect. Okay, let's take your pillow right there. So we need to shift your hips forward in the chair. So
Okay.
what we're going to do is I'm going to get you to lean back and you're going to shift your hips like that.
Okay.
Perfect. Good. And then
Okay.
now you can come forward.
Okay.
Yeah. Good. Yeah, and tuck your feet underneath you, behind you. Yeah,
Okay.
perfect. Okay. Actually, before we stand up, these armrests are even wider
Okay.
than the ones in the bathroom. So where do you think you should put your hands so that you don't have more pain in your chest when you stand up?
Probably right beside me, I guess.
Yep, let's try that out.
Okay.
Ready?
Yep.
All right.
Okay.
Very nice. Good.
Okay,
And you can just
good.
click up your brakes. Good. Let's go.
A patient's environment, their hospital room, and eventually their home may need to be rearranged while the sternum is healing. Keeping frequently used items within reach, moving contents from larger containers to smaller, lighter containers, and lifting and carrying items in Zone 1 will put less pressure on the sternum and allow for healing.
So we're going to try it a little closer.
Okay.
Okay, and try that out and see how that is.
Okay, great.
That still looks pretty
Yeah,
sore.
it's still really sore.
Okay, so what I'm going to do is I'm going to pour this for you now. And I think while the water jug is this full, you can ask staff to help you
Okay.
pour your water. But as there's less water in there, it'll be less weight, and you should probably maybe be able to do it on your own after that. Okay?
Hi, so how did it go today?
It actually went really well. I just noticed though when he was coughing, I just had to remind him to use his pillow to cough, so to really hug his chest when he was coughing.
Okay.
Yeah, and then I noticed that when he was getting up from the toilet and the wider chairs there in zones 2 and 3, when his arms were further away, he was having still a lot of pain.
Okay.
So I told him to bring his arms closer to his body and put them maybe on his lap when he stands up.
Okay, good.
Yeah, and the other part too I just noticed as well is that when his water jug was further away, it's still pretty heavy when he's reaching in like that zone 3 there. And even when we brought it closer to his body, the weight was still too much on his chest. It was still pretty sore. So we're still just helping him with the heavier items.
Okay, so we'll just have to make sure to like it's half empty or so that we're pouring it for him, and we'll see how it goes, and you just have to let us know how that feels.
Okay.
Okay, great. Thanks, Don.
Hey,
How are you?
I'm good. How are you?
Good.
Yeah, how'd your walks go? I saw you walking around there on your own.
Yeah, they're going pretty good.
Excellent, excellent. I'm just gonna turn that off.
Turn it off?
Yeah, there we go.
Okay, awesome.
You feeling like you need to get back to bed?
Yeah, feeling a little bit tired.
Yeah, you look like you need a little nap there.
Okay, good.
All right. I was hoping I could go over how to get in and out of bed there with you.
Sure.
Is that okay?
Yeah, absolutely.
Okay, perfect. So let's see you stand up.
Okay.
Excellent. So before we go, I'm actually just going to put the bed flat here because
Right.
your bed at home won't go up and down. So I'm going to make it more realistic here.
Sure.
Good. So do you want to take your house coat off?
No, it's okay. I'll leave it on. I'm
Okay.
a little bit chilly.
Okay, so just come sit up here. Probably actually, probably a little higher up here. There you go. Perfect. So what you're going to do, you're going to come down onto your elbow.
Okay.
You're going to put your head on the pillow. And then as you're doing that, you can start lifting your legs in. Okay? Okay, so
Perfect.
come on down. Yeah. Perfect. Oh, you look a little crooked there. So what you're going to do, you're going to move this leg over. Yeah, and then this one, you're going to push into the bed and lift up your legs. Perfect, right? And then for your upper body, you're just going to use your elbows and wiggle around a bit there. Excellent. Good. How does that feel?
Straighter.
Good. I can put your bed up just a little bit if you like. Good. And then we'll get you tucked in here.
Hopefully, this review of all the typical movements we assist our patients with on a daily basis will allow you to teach your patient how to move safely instead of restricting them or telling them no for activities of daily living. It should give you an idea of how to help them as well. Remember, it is our job to give patients the help they need, but this does not mean we lift them out of bed without their active participation. We need to coach them on how to move on their own and only provide the assistance that they require. This should begin the first day after surgery to allow them time to practice to become independent sooner. If you have any questions going forward, do not hesitate to ask any of the physiotherapists or occupational therapists.